This episode of Q Point Podcast is pre-recorded, produced and sponsored by Karina Quirk, broker at Next Home Experience.
Different views.
I know your story.
From different cues.
Incredible job.
He's David Quirk.
You brought it up.
And she's Karina Quirk.
Imagine.
This is
Q Point.
Joining us now in studio is Maine State Representative Chad Perkins. Thank you so much for joining us.
Thank you.
Yes, we appreciate your time.
So you serve as the Republican lead on the Government Oversight Committee. What specifically do you believe is the biggest unanswered question right now with the MaineCare fraud controversy?
I think the biggest unanswered question right now, and it's the biggest problem, is the complete lack of oversight in these government programs. We have dozens of programs that are funded by Medicaid, and there has been a complete lack of oversight by the Mills administration. Recently, the CMS, Center for Medicaid Services, Office of Inspector General, did an audit on just one program, the program for autism services. And in that one program, in just 1 year, they found that we had been overbilled by $45 million. And $28 million of that is in federal money. And they want that money back. So it's a big problem because there was no oversight looking into, hey, are there actual patients here? Are these being billed appropriately? And when the OIG came down and did their investigation, through their sampling, they found that 100% of all the encounters that they sampled were wrong. They were bad samples. So this was everything from people providing services that actually weren't licensed to provide services provided to people that weren't actually diagnosed properly as having autism, people that were copying and pasting session notes from one encounter to another, encounters that were billed that shouldn't have been billed because they were things like recreational activities, sleeping periods, eating periods that they're not allowed to bill for. And when you look at a 100% error rate, that's pretty problematic. That's a big problem. It's not like a few of them were erroneous. All of them were erroneous. And we're talking one program in 1 year. And the Department of Health and Human Services in Maine has a program integrity unit. It's their job to look into all of these programs to make sure that there are no problems. Well, obviously, they didn't look into this one program. And the state had been warned before that there were problems in their billing practices. So back in 2020, there was actually a whistleblower that came to the governor from the OIG that said, hey, listen, you've got some issues here. There's stuff here that looks pretty fraudulent. You need to look into that. 6 years later, this OIG report comes out, and obviously either that whistleblower was ignored or they failed to follow up because OIG came back down again and found this 100% error rate. And back in 2015, the OIG came down and did a report, and they looked into the program integrity unit, and they found that only 2% of all the actual problems that were found in billing errors were actually found by the program integrity unit. Everything else had come from some other source, from a whistleblower or something like that. So the fact that we have this program integrity unit and they're only finding 2% of the problems is telling me that there is no actual oversight, that this program integrity unit is not doing its job or not functioning effectively.
So where do we go from here?
The federal government issued a letter to the Mills administration and said, hey, we know there's a problem. It looks like fraud. And we want some answers because we want our money back. The Mills administration tried to stall. They sent a letter to the federal government that said, hey, we're not going to meet the deadline. And the federal government didn't accept that. They said, no, this is the deadline. You will provide these materials. The governor's response to that was that the state of Maine, or she personally, is being targeted for one reason or another. I don't believe that's the case. I believe that this is an actual case where the federal government is trying to do due diligence and make sure that their tax money is being spent appropriately. So I think where we go from here is that the federal government is going to come down and investigate this personally. And I think that needs to be done because we don't see that being done at the state level. Now, fortunately, as you mentioned, I serve on the Government Oversight Committee. We have voted at the Government Oversight Committee to take a look at the Program Integrity Unit to find out whether or not it was fit for purpose, whether it's doing its job, whether it's being effective, whether or not there are failures in that unit. However, the Government Oversight Committee, even though we have wide latitude to be able to look at stuff, we have a very small staff with OPEGA, which is our Office of Program Evaluation and Government Accountability. And we have other stuff in our workflow. So while we will be doing this, this isn't something that's going to happen overnight. And it will fit into the workflow after other projects that we have going on currently. Again, this isn't something that's going to be a magic bullet fix from GOC or OPEGA right away. So I think our best bet to get this under control immediately is through CMS and through the federal government.
Can you tell us exactly what types of fraud are you seeing?
Other types of frauds that we're seeing out in the wild that probably exist in Maine, which I don't think are being appropriately investigated now, is we're seeing places where home health care is being provided, and these companies appear to be shell companies. You have multiple companies that exist at one address. You have companies whose phone numbers are actually Minnesota phone numbers. There are some journalism outlets out there that are showing up at these companies, and there's nobody at these companies, or they're going to these places where the care is supposedly provided, and they're finding really atrocious and substandard practices being there. The Maine Wire is the primary one. And it's a shame that this is not being picked up by all the media outlets, because when we see this kind of fraud, not only are the patients not being taken care of appropriately, but when money is not going where it's supposed to. For example, when someone is being billed for a non-existent patient, there's a patient out there or someone that needs these services, this care, that is out there on a waiting list that is not getting that care. And the worst part is, we as taxpayers, we're paying for it. So someone is suffering, we're paying for it, and then someone is taking advantage of that, taking that money, and they're running for it. And let's say that the program integrity unit or a whistleblower or somebody identifies this and the state goes after them and decides to prosecute them. We have this foolish law in Maine that says that we can go after an entity, for example, an LLC, but we can't go after an individual. So a lot of these companies, like a home health care company, they're not like a hospital. They don't have an x-ray machine. They don't have an ambulance. They don't have a whole bunch of equipment that when we go back to claw back money, we can get assets that we can then sell and get resources back that pay back the people of Maine and their tax dollars. They really don't have anything. Again, they might have a small office and a mailbox. So when we going after these people, because we're only going after the LLC or this organization, there's nothing to claw back. A lot of time this money is gone. It's in the wind and we're never going to recover it.
So is that part of the reason why all of our taxes and fees continue to go up?
Well, that's one of the reasons, yeah. And unfortunately, as you know, the state budget has gone up quite a bit under this current administration. I think the numbers now is 45% since the current governor has taken office. And we see a constant increase in the budget every year since she's been in office. But one of the biggest reasons is the expansion in MaineCare. And look at New Hampshire. It's almost the exact same size population. And yet we have twice as many people on MaineCare. I think they call it Granite Care down there, but it's their equivalent of our MaineCare. And not only do we have twice as many people on it, the cost of administration per person is 50% higher in Maine. Even when you look at economy of scale, the more people we have on it, the cheaper it should be to administer, but it's not. It actually costs more per person in Maine to administer the program. And these are just the administrative costs, not the actual treatment costs or program costs. Just the administrative costs are 50% more per person in Maine than it is in New Hampshire.
So I read in the Bangor Daily News where there's over 400,000 people on MaineCare, which is almost 35% of the people who live in the state of Maine. And obviously MaineCare pays the hospitals less, around 60 cents on the dollar. What are you hearing about that?
Yeah, I know paying the hospitals is a big issue right now. The state doesn't have the money, so they're prioritizing the money improperly, but they're not paying the hospitals. I know back when I was the director on the board of an ambulance service, this was some years ago, the Mills administration wasn't paying the ambulances sometimes. And we had a problem making payroll and keeping our ambulance afloat. I'm no longer on the board of the ambulance. I don't know if that's still a problem, but this is a pattern of behavior that continues under this administration.
So the committee that you serve on, how much power does that have?
GOC is unique. We're the only committee that can issue subpoenas, and we're the only committee that can bring someone before us and make them testify under oath. And the committee is also unique in that it's ostensibly the most nonpartisan committee. Most of our committees, because we have a majority and minority party, most of the committees, the chairs will be made up by the majority party, and then you'll have more members in the majority party than the minority party. So that's how the votes go. But in the GOC committee, you have an equal number of members from both parties, and they have to be the two most important parties. You can't have any independents or unenrolleds or Green Party members or anything on GOC. You have to be either a Republican or a Democrat. So you'll have 6 of each on the committee, and you'll also have 3 House members from each party and 3 senators from each party. And in order for any action to get through, you still have to have 7 votes. So it's a simple majority. And while we do a fairly good job trying to be nonpartisan, because I think most of the work we do, everybody on that committee works towards getting the best thing for the people of Maine. They're done in the State House without politics. There is a little bit of politics that goes on. But as far as the power, it's unique because we can get more information, not as the committee, but through OPEGA. We can task them to go get records that maybe most committees can't get access us to. We can task them to do research projects that most committees don't have the resources to do. And we can call the governor down. We can call the Department of Health and Human Services commissioner in front of us. We can call anybody in front of us. A lot of times they'll send a representative, but if that's not good enough for us, we actually have the ability to subpoena a person. They haven't done it in a while, but I tell you, our last meeting, we had a discussion about actually implementing that tool again.
Speaking of DHHS, what are your thoughts on all of the child deaths that have been happening throughout the state?
This is a subject that the Government Oversight Committee seems to keep addressing, and this is a subject that's very frustrating to me. I made a comment in the GOC meeting last month, and I made it to the commissioner that I was very upset that it seemed to me that a third to a half of our time seemed to be dealing with something that had to do with her department. And it was repetitive. It was the same thing over and over and over again, and there weren't any solutions, and there didn't seem to be any accountability. But we're continuing to see the same problems. And we keep tasking OPEGA to get records on this or to look into this. But I don't think that there's going to be an easy fix without changing leadership within the Department of Health and Human Services. The former senator and the late Bill Diamond, I know this was a big passion of his, and he served on the Government Oversight Committee. And I know that Senator Timberlake, my colleague on the Government Oversight Committee, this is also a big passion of his. But I think everybody on that committee, and this is probably one of the most nonpartisan things we deal with, is that everybody on that committee wants to make sure that the state does not fail in any way, and we end up with a dead kid because of it. Unfortunately, it's something that we're continuing to deal with, and despite our actions, we don't seem to see a clear end to the issue, and I don't think that's going to change until we see a change in leadership within that department.
But haven't we seen a change in leadership within that department a few times?
We have, but we're seeing promotions from within the organization, and I think a change of leadership needs to come from another source. If you're promoting from within the same structure and the same culture, I don't know if we're making any progress.
So essentially a new governor.
That would be a good choice.
So what have you heard about the no-bid contracts?
GOC has also taken up the issue of no-bid contracts. We looked at the latest audit by Auditor Matt Dunlap. Obviously, there was some disagreement between the DFAS director and the auditor, but because we were tasked with it, we have assigned OPEGA to look into that, and that's something that the committee is currently working on, and hopefully we'll have some answers on that soon.
It sounds like you're sending a lot to OPEGA. What's the turnaround time on these issues?
Well, it depends on the project. Some projects are quicker than others. Sometimes we get answers back in just a couple months, and some of these projects can last over a year.
Speaking of OPEGA, if they find that the Program Integrity Unit is understaffed or outdated, or they have outdated technology, what should be the legislature's next move?
Depending on what OPEGA comes back with for a report, we would get a report back from OPEGA, our director, and then we would make a recommendation to DHHS on what should happen. And then we might actually recommend to the committee of record to report out a bill on that. And that could be an increase in funding so that they could get better software, for example, to track billing trends, to look for something that's suspicious. So maybe instead of increasing the staff of the Program Integrity Unit, you could keep the same staff, but with better software, they could do it much more efficiently. It could be adding people to the unit. It could be changing the structure of the unit. It could be assigning more people to the AG's office that are assigned for prosecuting this. We won't know until we get the report back. But the first step is getting a look and seeing what is failing within the unit. Why are they not finding this fraud?
So to take it a step further, how about finding a system where we could be proactive instead of reactive and maybe not issue these funds to people that shouldn't have the funds to begin with?
I think that's a good idea. If we vetted some of these providers more thoroughly prior to allowing them to participate in the program, I think that we could avoid a lot of these problems.
So at this point, obviously, it's alleged fraud. Has any of it been confirmed?
When you say confirmed, there hasn't been any court cases. There's no convictions yet. But one of the problems is that portion of the investigation falls on the Attorney General. And right now, I don't believe that our Attorney General has the ambition to go after these kinds of cases. This was brought up in the committee meeting. One of the members there said, hey, it doesn't say the word fraud in this report anyways. But if I talk about a vehicle that has 4 wheels and 4 doors and a windshield and a steering wheel and 2 seats and you use it to drive to work every day, I'm talking about a car. I don't have to say the word car. Additionally, after Dr. Oz issued the original letter from CMS, he came out and did a video several days later and used the word fraudulent behavior several times. He said, this is fraudulent behavior. He said, this is exactly what we're seeing in other states. He said, this is what we're seeing in Minnesota. He said, all these trends are the same. He said, this is fraudulent behavior. So you may not have this nice letter prepared by CMS sent to the state that says, we know for a fact this is fraud. But there was some wordsmithing there. They're talking about fraud. I would bet my bottom dollar that we're going to find large amounts of fraud should the feds come down and actually do a full investigation on this.
If we weren't in a political climate with a lot of people in the administration running for office, do you think we'd have different outcome?
No, this lack of accountability. If they weren't running for office, they would just be waiting out the clock. There hasn't been any accountability, and I don't think that all of a sudden there's going to be some kind of epiphany that said, oh, wait, now I'm going to take accountability. If they weren't running for office, they would just be out of here at the end of this administration. They would try to run out the clock, and they would just not take any accountability till then.
What you're saying, I guess, is they just want the next governor, whoever that is, to fix this?
Well, I don't know if they want them to fix it. I don't think they want any accountability. I don't think they want their name attached to it or any kind of accountability until they're out of that office. And after that, I think that they really don't care what happens with it.
How much money are we actually talking about?
So everybody talks about this $45 million in total, and then $28 million of that is federal dollars. But that's in the letter. If you read the letter, it says this is what we know for sure. That is what was overbilled, and this $28 million, that's what you have to pay us back. But if you look deeper into the letter, it says, by the way, here's an additional $22 million of our money that we want you as the state to look into, because this is probably also overbilled, and we want that back. So it's not a matter of $28 million that we have to pay back to the feds. We're talking almost $40 million that we have to pay back to the feds. And that's $48 million in a budget that we don't have. We have a constitutional mandate in the state to have a balanced budget. Well, I've looked over the budget, and I'm not a budget guy. I'm not on appropriations. But I went through that budget, and I don't see that $40 million built into that budget anywhere.
Let's not forget, it's taxpayer money. It's not their money. And they're losing the money, allegedly, and then they have to pay it back, which means our taxes are going to go up again and again and again. So there needs to be an end to this and a plan going forward, in my opinion. You are listening to Q Point Podcast. I'm Karina Quirk, co-hosting with my husband, David Quirk, and we are having a discussion with Maine State Representative Chad Perkins.
So I read that you're on the Criminal Justice Committee. What's going on over there?
Criminal justice and public safety, I'm on my second term there. I love serving on that committee because I have a background in law enforcement, but it's also a very frustrating committee for me. Every term I've been there, I've seen that there's nothing but bill after bill after bill that tries to weaken our criminal justice system. I'm a big supporter of a victim-focused criminal justice system. And yet all I see while we're there is the other side submit bill after bill after bill, and they're just trying to tear that down. The focus seems to be not on the victims, but on the offender. Whether it's this bail reform, which is just awful, whether it's increasing the amount of drugs that someone can have, whether it's changing Good Samaritan laws, whether it's reducing sentencing, I really believe that they value the offender over the victim. And having dealt with victims in a 17-year law enforcement career, I can tell you that's harmful to our society. When someone calls a police officer, they're looking for help. And then when they go through the court, they have to feel like they're going to get justice. And when they go to a court and a district attorney tells them, hey, we're not going to prosecute this, or worse, they send a letter down to a police officer and they say, hey, go tell this person we're not going to prosecute. And I have to go tell them, hey, there's a decline to prosecute. The look on their face when they hear that is terrible because they know there's no justice there. And when they see that person that has committed a crime and caused them harm or violated their rights is walking around without any kind of justice, it's a harm to our society. That starts to break down our society. And people need to feel like there's a sense of justice. There needs to be restitution for damages that are done. There needs to be some kind of justice so that people know that, hey, people can't just get away with stuff.
So what are your thoughts on cashless bail?
I think it's awful. One of my greatest heroes nowadays is the Brewer Police Chief, Chris Martin, because he is a strong, outspoken, and unapologetic opponent of cashless bail. And he will tell you, and he's been down in front of our committee time and time again, giving us example after example, real-world examples of how this has hurt the victims of his city, the city of Brewer. And I hear from police chiefs, former colleagues, and other officers that I've worked with how this has affected them. But he's the one that will come down and go on mic and say, hey, this is a real-world example time and time and time again. But even though he comes down and does that, my colleagues on the other side of the aisle in that committee, it doesn't seem to faze them. It doesn't affect them. And it's bothersome to me that they put the emphasis not on the victim.
Chris has been on our program a few times, and he is a good friend, but he is the first one that brought to us that the Bangor market is now seeing kilo quantities of cocaine, fentanyl, methamphetamine, and they didn't see it 5 years ago. What is your perspective?
When people know there's no consequence for their action, then they're going to do it. I hear this stupid phrase in the Criminal Justice Committee all the time. They talk about, well, decriminalization is fine because having a penalty doesn't deter people. Well, we know it deters people because when you take that penalty away, the bad behavior increases. So to say the opposite, it's ludicrous. But that's what they believe. They believe that having penalties has no effect. But somehow when you take the penalty away and the behavior increases, well, obviously it has an effect because that increase came when the penalty went away. We see it every day in committee, time and time again. And like I said, it's harmful to our society. People don't feel safe like they used to. I grew up in Maine. I went off to the Army. I came back here to raise my kids. We have a lot of kids. I came back here because I wanted a safe place to raise my children. This is not the Maine I left. We see crimes that I never would have thought I would have seen coming back to Maine. And I know drug use is up nationwide, but I see things in small towns that we never would have thought. We have cartels that have set up shop here in the state. You look at some of these towns along the highway that have become distribution points in Maine. Who would have thought of that? It boggles my mind that this has happened.
So speaking of law enforcement, I read that the town of Stonington did not renew their contract with the Hancock County Sheriff's Department. Have you seen any of that?
Yeah, rural patrol in Maine has always been an issue. It's a challenge. And when a town doesn't have a local nearby resource, that resource has to come from far away. Working up in Piscataquis County is the size of the state of Connecticut. And most people don't realize that overnight, there's only one officer on at night, and that's for the town of Dover. At one point in my career, that was me. And anybody else that had to come out in the middle of the night had to be called out. So you had to get up, put on your uniform, and respond. There were times that I responded to calls at 2 o'clock in the morning and go out on some fire road. It took me 25 minutes to get there. And I knew my nearest backup was 45 minutes to an hour away. And that puts you in kind of a unique situation because if you're going to, I'll give you an example. I went to a stabbing out on one of the lake roads and I wasn't sure exactly what I was walking into. And I'd already called for backup, but I knew that the minute I got there and we've got a volatile situation, we've got someone with a weapon that's already assaulted somebody else with that weapon. I have nobody there to back me up. So this defunding thing that went through nationwide, luckily didn't hit Maine as hard as it did throughout the rest of the country. But it's really hard for small towns and counties who are facing budget crises to justify local police resources. But they are needed because people need that resource. The state police can't cover everything. They don't have rural patrol everywhere. We've tried to put it, or we've put in bills to increase some of that. But the sheriff's offices, because those are paid for by county taxes, and you know how county budgets are now, they can't pay to have 30 deputies on every county sheriff's office. So it's always a challenge to manage those resources and balance county and municipal and then have them backed up by the state police. It always is a challenge. Now, granted, when you move to someplace rural, you know that. You know that, hey, my ambulance isn't going to be 3 minutes away. My police response isn't going to be 3 minutes away. If you really need those things, go live in Bangor, go live in Brewer. And that's the trade-off. I live in Piscataquis County because I want to be somewhere that's a little more rural. But when Brownville closed their police department, we made the decision to then move to Dover because Dover still had a police department and we were still in a fairly rural community. And while not every town is going to have a police department, people have to make the choice of what kind of trade-off do I want? But we can't have every town without a police department. We can't have every sheriff's office with a bare minimum staff. We do have to have some policing out there.
So recently we had Commissioner Cushing here to discuss the new correctional facility in Penobscot County. Is that a topic that is brought forth in front of the Criminal Justice Committee?
Yep. Actually, we just dealt with that bill the other day. And we got actually a very good outcome with it. When the jail funding formula was set up, it was set to a set amount without any real increase year over year. And that was problematic because costs go up each year, but the amount of money wasn't going up. So the commissioners and the sheriffs wanted a bill that would raise that by, set it at a higher baseline of $28 million and then go up by 4% per year. We didn't actually think the $28 million was high enough. So in the committee, we were able to work a deal with the other side. So we raised that to $30 million. And instead of a set 4% per year, we tied that to the CPI. Because, you know, back in 2021, the CPI was 7%. The following year was 6.5%. And yet other years, just this last year, the CPI was only 3%. So if we could tie that to an economic standard where where if 4% wasn't enough, the state would still cover that. We thought that would be better. So there was also a set amount of money that had to be spent, 25% under the original statute, under the bill. 25% of that money had to be spent on community resources. And that kind of tied the hands of the jail administrators and the sheriffs on how they could spend that money. Well, every jail is different. If you go to Piscataquis County Jail, you go to Penobscot County Jail, two completely different jails. If you go down to York County Jail, completely different jail. I've been in all these jails. You wouldn't believe how different they are. I mean, stark contrast. Different populations, different administrators, people that are in there for different reasons a lot of times. So these sheriffs know how to run their jails. They hire jail administrators that know how to run these jails, and they do a good job running their jails. It's not really right for the state to go in and say, you will spend this much money for these programs. Maybe this jail needs that much. Maybe this jail needs a little bit less. Maybe this jail needs a little bit more. So we were able to negotiate a deal to lower that 25% down to 20%, giving the jail administrators and the sheriffs a little more flexibility on how they could spend that money. So the final deal was raising the base to $30 million, adjusted each year by the CPI or the Consumer Price Index, and then lowering that 25% mandate down to 20%.
Thank you for joining us for Part 1 with Maine State Representative Chad Perkins. Make sure to tune in to Part 2 tomorrow, Sunday, April 5th at 6:30 a.m. on VOM, the Voice of Maine.
You've been listening to Q Point.
Follow us at qpointpodcast.com or on your favorite streaming app.
Q Point Podcast invites guests and candidates from all parties to join the conversation. The views, information, opinions, and comments expressed during this program do not necessarily represent those of the host, Q Point Podcast, associates, affiliates, and CQRE LLC.